Hi, everybody. My name is Taylor Fredrickson, and I'm going to be looking at the risk and benefits of physical activity for individuals with cancer. As an exercise physiologist, I work usually daily with individuals that, one, have already undergone cancer treatment and are cancer survivors, or two, people that are currently undergoing cancer treatment. So I thought it'd be a good idea for us to look a little bit more closely at physical activity for those with cancer. So, first of all, what is cancer? Cancer is a group of nearly 200 diseases that is caused by continuous uncontrolled growth of abnormal cells that form due to damage to our DNA. So, that can be caused by internal factors such as gene mutations. Our body has gene mutations every single day, but usually we do a really good job of being able to locate those and destroy them before they cause any issues. Unfortunately, for those that have cancer, that's not the case, and they are not destroyed and they continue to multiply. And then also outside environmental factors such as carcinogens, tobacco smoke, chemicals, things that we know and research has been done on that cause cancer when we are exposed to them in large doses. Also, most of those with cancer are being diagnosed over the age of 55, but it can occur in any age range. So that age group is going to be important. We'll talk about that here in a minute. There are some special considerations for those that have cancer. So, like I said, a lot of people that have cancer are over that age of 55. So, there are probably going to be some pre existing conditions going on also besides just the cancer diagnosis. So, that can be things such as high blood pressure, diabetes, osteoporosis, arthritis, high cholesterol, things that also need to be taken into consideration while making an exercise plan. These people are also going to have major side effects that can be due to treatment or the cancer itself, and that can lead to a diminished physical function. So things such as fatigue, nausea, dizziness, and there are many more. Those are just the most common. So side effects are something that does need to be monitored, and they can change daily. So a study was done on cancer survivors that have been over cancer for more than 5 years. And more than half of them actually reported that they had performance limitations. So things such as crouching, kneeling, walking, standing for large periods of time, carrying more than 10 pounds. Those all became very difficult for them after surviving their cancer. So if that could have been caused by the treatment, that could have been caused by the cancer itself. We're not really sure, but there are physical performance limitations that are very common in this group of people. Also, 90% of all cancer survivors will experience some form of cancer-related fatigue. So fatigue is huge, and we're going to talk about that a couple times in this presentation. Fatigue is going to be one of the major things that we're going to have to watch for. Heart rate reserve is not reliable in monitoring exercise intensity due to changes in resting and maximal heart rate because of treatment. So their heart rates may not be what they usually were before starting treatment. So heart rate reserve is not going to be a good way of monitoring intensity. There's other ways we can do that, and we'll go over that here in a minute. The ACSM says that exercise guidelines should be the same for those with cancer as they are for the general public. So that is good. So 30 to 60 minutes of moderate to vigorous physical activity at least 5 days a week. It's important to remember that dose-response relationship. So obviously the more days that we do exercise, the more health benefits we're going to see. But with those with cancer, we have to be careful of doing too much. So we're going to jump into aerobic training guidelines. A minimum of 3 to 5 days a week, a moderate to vigorous intensity. I decided to use RPE when deciphering intensity just because VO2 reserve, heart rate max, those aren't going to be as reliable. And they're also a lot harder to measure. So I decided to use RPE. So for moderate exercise, that's going to be anywhere between a 12 and a 13, and vigorous, anywhere of an RPE between 14 and 17. The time, 75 minutes a week of vigorous intensity or 150 minutes a week of moderate intensity, or a combination of the both. So switch it up. Go harder one day, go lighter the next day. Just make sure you get that time requirement. The best exercises for these people are going to be prolonged and rhythmic forms of exercise that use large muscle groups. So things such as swimming, cycling, walking, things like that. That's really going to help target larger muscle groups instead of, let's just say, using just the upper body or lower body. It's going to use more muscle groups. And it is also okay for these people to exercise every day. Just make sure you have lighter and lower progression of intensity. So don't progress as quickly as you probably would with a normal individual. When it comes to resistance training, same as the general public, 2 to 3 days a week. of a form of resistance training. So start with a low resistance, so less than a 30% 1 rep max, and progress with the smallest increments possible. You do not want to overtrain these people. You do not want to burn them out. You do not want to fatigue them too much. Fatigue is going to happen with exercise. That is a normal response, but we don't want to get that lasting, prolonged fatigue that can happen very easily with people with cancer. So we're going to do one set of 8 to 12 repetitions to start. And like I said, you can do small progressions after that, but nothing crazy. The best forms of resistance training for them are going to be free weights, resistance machines, and weight-bearing functional tasks. Those are huge. I use these every single day since most of the people I do work with are either sick or elderly. One I actually use a lot is called a sit to stand. So just simply learning how to sit and stand up out of a chair the correct way, which is actually a squatting movement. You don't want these people to lose that functional ability. You don't want them have to rely on someone to get them in and out of a car, to shower, to dress themselves, to eat. You want to make sure they're able to do all of those functional tasks before they get to an age where they can't regain them. And flexibility guidelines, so at least 2 to 3 days a week, but daily is going to be the most effective for these individuals. You're going to go through a range of motion in every joint as tolerated. 10 to 30 second hold for each static stretch. And with people with cancer, there are going to be areas that are restricted and areas that might be painful. We're going to want to know those areas and target those areas. These are caused by disease progression and treatments. So we want to target those areas and make sure that we stretch those a lot, just to make sure that we aren't getting stiff and painful joints, we're not getting too tight, and we're not losing mobility. So look out for those areas and make sure we are targeting them in the flexibility plan. So, just like the general population, the benefits of physical activity far outweigh the risk. So we're going to talk about the benefits first. Benefits of physical activity for those with cancer. The ACSM has concluded that there is compelling evidence to support that exercise is, one, not only safe for those with cancer, but is also extremely beneficial. So that's good. That's something that you can tell these people to kind of help them get on the right track and get in the right mind frame when starting an exercise program. Survivors should avoid being inactive after their treatments. So a lot of people that have just gone through cancer treatment are not in the best mental state. That is completely normal. Physical activity is actually going to help with that. You don't want them to wait too long after treatments because they're less likely to start an exercise program. So starting them right off the bat is the best way to make sure that they're getting these benefits. Exercise is going to lower their chance of experiencing severe physical side effects from cancer or the treatments, such as lymphedema, nausea, osteoporosis. If we can limit those things, they're going to be a lot happier and a lot healthier. And also, you can reduce their chance of experiencing anxiety and depression. We just talked about that negative mental state, trying to get them out of that and move forward. Preventing muscle and bone loss. Cancer can cause muscle wasting and bone density loss. That is normal and is also a normal form of aging. So we want to prevent that at all costs. And then also just staying mobile and independent. That is going to be very important because a lot of people with cancer, especially when they're going through treatment, do rely on other people a lot, and that can make them not feel very independent. So if we are able to help them regain their independence, be mobile, not just sit at home and rely on their family, friends, they're going to feel a lot better physically and mentally. So just like any general population or exercise program, there are going to be risks involved. But like I said, the benefits far outweigh the risks, but it's still important to know them so we can be aware. Biggest thing we need to look for in people with cancer is immunocompromising. These people are already going to have a suppressed immune system just because they have cancer and they're going through really harsh treatments, chemotherapy, radiation, that are going to just pretty much make their bodies attack themselves in order to get rid of that cancer. That low immune function can make them get sick very easily, and that can really impair their treatment. So a lot of the times it is good for these people to exercise at home. So if you can make an exercise plan that these people can use at home, that would be great. Or in a medical setting. So instead of just going to a normal gym, it can be more beneficial to go to maybe like a wellness center run through a hospital. We have higher sanitation guidelines and we're just more aware of how to deal with these individuals. So those are two options that could be beneficial to make sure that we aren't compromising their immune system too much. Overtraining is also gonna cause a lower immune function. So we talked about not overtraining them because that can be easily done because their fatigue can be so high. So overtraining is something we need to watch out for and make sure it does not happen whatsoever. Bone fractures are common, especially in those with metastatic bone disease. So people that have cancer that has one either originated in their bones or metastasized to bone, they're going to have a higher incidence of bone fracture. So doing low impact activities before progressing to high impact is better. That low impact activity is going to help with that bone density, and then once we feel like they have accomplished that goal, move them up to a high impact. That's just going to make sure we minimize that risk of a bone fracture break. Those with heart complications due to either their treatments or their cancer need to be closely monitored for acute myocardial infarction or sudden cardiac death. So just monitoring those individuals, their symptoms, how they're feeling, their fatigue is important. AMIs and sudden cardiac death are not common in the general public, and their risk is very low even for this population. So it still needs to be monitored even though it is not common. Just monitor symptoms is the most important thing. A lot of people with cancer will have lymphedema, so swelling, and they can use compression stockings. That's kind of going to help minimize that swelling. Muscle wasting is another thing to be aware of, and that can be common in certain forms of cancer, especially those that have gastrointestinal forms of cancer. They're not usually meeting their energy needs. They're not being as active. So muscle wasting can actually be quite common in these people. So physical activity is actually going to help with that. So that is all I have. Thank you. And hopefully this helped you with knowing some of the risk and benefits of physical activity for those with cancer.